One of the great things happening in Santa Clarita is that we are on the Providence Holy Cross Health Hour, and I have Dr. Bernie Klein here. He's the Chief Executive at Providence Holy Cross. We've been talking about a little bit about him, a little bit about the Affordable Care Act, and I wanted to get more into it. So I wanted to know, people are, struggling with this. It's kind of a weird thing. I mean, it's tax season, so it's people were asking questions. This was something that impacted them a lot. Because they were like, what's going on with this? But I wanted to ask, what did your hospital or Providence do to help people with this healthcare reform that has been going on?
Well, that's a great question, Kyle. Providence, including my hospital, have done a variety of things to help people navigate through healthcare reform. One of the first things we did was we are a participant in the Access to Care program, in which we try to connect people with insurers so that they can access insurance and navigate that whole process. And I think that's been fairly successful. We've been working very closely with our community leaders in doing that by providing some resources in terms of personnel, being present at events so that we can reach out to the community. Because it's so important, if you can get insurance, to have insurance. A lot of people are young, they're healthy, they're thinking, I'm going to live forever, but unfortunately, sometimes bad things happen, and sometimes they happen when you least expect it. We are a level 2 trauma center, and I hate to say it, but almost every week we see somebody in an accident, and you and I know that day when they woke up, they had no intention of coming to a hospital.
Yeah.
So it's really important that we get people connected to get the insurance that is available to them. In addition, we work in our ER to connect people with primary care doctors, because the ER, it's a great place to go if you need it, but it's a very expensive way to get care. And it's very episodic in the ER. You don't have a long-term relationship with the physician, and that's so critical. As a primary care physician, over the time I got to really know my patients. So when they came in with a concern, I had a pretty good idea how serious it is and how aggressive I needed to be to work it up. When you don't know the patient, you automatically think of the worst, and you work them up to make sure they don't have the worst situation, and then you relax, and then you do some treatment and send them on their way. And so we work very hard to connect them to the community. In addition, we are going to be funding a mobile van. We've done that in the past. We're going to do that in the near future so that we can have a van actually go into some of the underserved communities and provide services at a reduced rate.
So I wanted to ask you, so you're in the ER, there's an individual that needs... they need care, but maybe not an emergency type of care. What happens in that situation? Obviously, you care for them if they need it. But do they have like a meeting with somebody? They say, okay, listen, this physician is really close to you. He can get to know you on a more regular basis. Our ER is it like that type of consultation?
Yeah, that's the type of consultation, especially for patients who are repeat visitors to the ER.
Okay.
Those are the ones in particular we try to help attach to a physician in the community. Again, because the ER is not a good place for chronic treatment for your diabetes and hypertension on an ongoing basis. But it is a place you want to go if you feel like you have a life-threatening emergency.
Yeah, and it seems like I just totally lost my train of thought. But it's more expensive. I mean, I look at my insurance, and it's more expensive. It's rather than a copay to just go to your regular physician. It's like it could be more to go to the emergency room too.
It's significantly more because in the emergency room we're providing services 24/7.
Yeah,
and so to be able to provide those services. We have physicians on call 24/7 in all different specialties, and our trauma docs are on site 24/7, and we have staff working 24/7. So it is an expensive way to get care. Again, my belief is a hospital is a great place to be if you need to be there. It's a dangerous place to be if you don't need to be there.
That makes perfect sense.
Yeah.
So you mentioned the van, and you guys are out at events, and you guys, if you see something that says Providence Holy Cross, walk up and they can help you.
Absolutely. And if that person can't help you, they can certainly connect you to somebody who can. We also do education in the community. We have promotores, which are lay people who have been trained in healthcare, and they're out in the churches, and they educate the congregants at the church around good eating habits, good healthcare, screening, appropriate screening to get or ask your doctor about. We also provide nurses for some of the schools in the community that can't afford to have a nurse. And you know, you have a lot of kids at school, stuff happens at school. It's wonderful to have a nurse there that can evaluate the person and make sure that they're okay, or if they're not, that they get rapid help.
And so I have notes here, and it says financial counselors at the hospital. What are financial counselors at the hospital?
We have counselors at the hospital that will help patients and their families if they aren't able to afford the cost of care. That's a hot topic these days. There's a lot of discussion around hospital charges, which you and I could spend days talking about because it's so complex. But what Holy Cross and all our Providence facilities do is if you really can't afford, if you don't have insurance and you really can't afford to pay, we have processes and policies in place to work with you so that we can help ease your burden and make sure you get the care you need and pay what you can pay.
Excellent. We're going to take another break. This is the Providence Holy Cross Health Hour on AM 1220 KHTS. We're speaking with Dr. Bernie Klein. He's the Chief Executive of Providence Holy Cross. I want to remind you to go, if you want more information, you can go to providence.org/Holy Cross, and there's information there. You can even see a picture of Bernie on there. You can see a picture of him there. We're going to take a quick break. More after this. We have Dr. Bernie Klein. He's the Chief Executive at Providence Holy Cross. We've been talking about some of the changes that have been going on with the Affordable Care Act, and let's stay on that vein, if you don't mind, and talk about, so what things have the hospital been working on due to healthcare reform and all the changes that are impacting your hospital?
Well, that's another great question. So in addition to the Affordable Care Act being about insurance and insuring people, there is a small section there around value. And in fact, that's where healthcare is going, whether we have the Affordable Care Act or not. The reality is we were on an unsustainable path.
Okay.
Right? So healthcare costs were increasing faster than the cost of living and faster than people's salaries. So we got to the point where the ordinary person could no longer afford health care, even employed people, and that is not sustainable. And we were doing that at the expense of infrastructure for the country. So a big portion of what Providence and Providence Holy Cross and hospitals across the nation are doing right now is figuring out how we can improve the value proposition of healthcare. So what do I mean by that? Well, I would define value as the quality of care you receive times the satisfaction for the care you receive divided by the cost of care. So better quality, better satisfaction at a lower cost. And that is really what the game is about today. So Medicare or CMS created something called a value-based purchasing report card. And what they do is all hospitals have to participate, and what they have some quality metrics that you have to achieve on. They have mortality metrics. They have satisfaction metrics, they have safety metrics, and they actually have what they call efficiency metrics. And the way it works is they withhold some of the dollars a hospital receives for taking care of Medicare patients, and then depending on how you score on these metrics, relative to other hospitals, if you do better than the other hospitals, you actually get additional money back. If you don't score as well, you lose money. So it's a zero-sum game. And that was Medicare's attempt to incentivize us to improve the value equation. Holy Cross tends to do exceptionally well on value-based purchasing. We tend to have very high quality metrics, very good mortality metrics. You are less likely to die of an...
I was going to say, the mortality, better mortality means less of it.
Correct.
Yeah, I don't want people
you have
to get
a
confused
better
there.
than expected chance of surviving a condition at Holy Cross than most of the hospitals across the nation.
Is there a balancing act with, because you talked about all of that, and then also satisfaction and then efficiency? Is there, in terms of because I think there's a difference between being efficient and rushing people.
Absolutely.
So is that the tough balancing act, to be efficient while also getting people the right care?
It's a great question. I don't think it's a tough one at all. I think if you do the right thing for your patients in a compassionate way, in the right setting at the right time, they're going to be happy, and efficiency will take care of itself. And so I don't think there's a trade-off there at all.
And probably, I would think, I don't want to be sitting in a hospital for a long time. So you want your physicians to be efficient also, because it'll make me feel better as a patient.
So what you want is you want teamwork, you want collaboration, and that's where Holy Cross excels like no other hospital I've worked at. I've worked at hospitals in LA, I've worked at hospitals in Atlanta. I actually traveled for a year and worked at hospitals all across the nation. I've never worked at a hospital where there's such incredible teamwork and collaboration as I had at Holy Cross. That is what attracted me there, where our physicians and our nursing staff and our ancillary staff, our phlebotomists, our environmental services workers, and the administration team work so well together. It's fun when you have everybody working well together. We don't always agree with each other, and we're very demanding of each other. The medical staff demands that I provide a better and better quality product, and I demand that they provide better and better quality care. But when push comes to shove, if we don't agree, it's always, so what's in the best interest of patient care, and how can we achieve it? And that's why Holy Cross has been able to really do some remarkable things. We're a magnet hospital, which is a higher level of nursing care. Only 7% of the hospitals in the nation are magnet. We're the only magnet hospital in the Valley, whether you're talking San Fernando Valley, Santa Clarita, Simi Valley. We're the only magnet hospital. And value-based purchasing, we tend to be one of the highest scoring hospitals amongst all of Providence, which is over 36 hospitals. And so we're very, I think the community is very fortunate to have a gem of a hospital so close.
Fantastic. I want to ask you, why do you think that Holy Cross did so well in terms of teamwork? What do you think the difference is? Like, why is it so much better there than it is at the hospital in Atlanta and LA that you were at? What is the difference?
I think there's a variety of things. Number one, Holy Cross was actually destroyed in 2 different earthquakes, and while it was destroyed, it kept running. And nothing pulls people together like a crisis. Yeah. Number two, we've been a trauma center for a fair amount of time, and in order to do trauma, you have to have excellent teamwork. And so I think that's part of it. And three, it was a culture that I inherited, that the previous chief executives and chief nursing officers created. And so I see my job as continuing to nurture that culture, because I think that results in better outcomes, which is what you and I want if we step foot into a hospital.
Now, I wanted to ask you just a quick thing. Emergency room and trauma center, what are the differences there? Because you said trauma center, you need great teamwork. In trauma center, what would classify an emergency rather than a trauma situation?
They're similar. So the emergency room will treat anybody who walks in the door. To be a trauma center, to be a verified level 2 trauma center, you actually have to go through a rigorous process where you submit an application, they come on site, they do a survey, and they grant you that status. But trauma isn't just about the ER. It starts in the ER, but then it may go into the OR, it may go up into the ICU, and the continued care by a trauma specialist until you are able to move on back home, hopefully, or onto rehabilitation.
Gotcha. Okay, I was just wondering.
Yeah, no, that's, if you're wondering it, I'm sure somebody else is too.
Yeah, so the trauma, there's somebody, the head of the trauma department there? Did you say there's a head of trauma doctor?
We have a physician paired with a non-physician. And in all our departments, we have a physician paired with a non-physician. And so they ensure that we provide high-quality, consistent care.
Good grief. That seems stressful. It seems stressful.
It is, but I think they thrive on.
Yeah, I bet. Yeah, certainly.
I think it's a bit.
That's what nurses and doctors do, man.
It's a bit of adrenaline rush.
Yeah, that's what they do. We're gonna take another break, and we got more with Dr. Bernie Klein. He's the chief executive of the Providence Holy Cross Medical Center, and this is the Providence Holy Cross Hour on AM 1220 KHTS.